Hello, my name's Dr. John Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm also a consultant at the New Farm Clinic, which are both Ramsay Health facilities. Today I'm going to talk to you about a psychiatric illness, schizophrenia. The best time to treat schizophrenia is as early as possible, because the symptoms of schizophrenia can be distressing, such as hallucinations, which are distressing, or belief systems, such as abnormal, bizarre beliefs that also might be upsetting. The other reason to treat it early is because you lose touch with your family, friends, social, occupational functioning declines. So if you treat the symptoms as early as possible, then you can limit the decline and you can also limit distress. And that's what the treatments are focused on: resolving the symptoms, limiting distress and improving function. Get into treatment as soon as you possibly can, and that's usually via your general practitioner or via a mental health service. When a patient comes to a psychiatrist for their first visit, the usual procedure is much like you're speaking to any other doctor. Psychiatrists are medically trained, and we look for symptoms, signs, and how the symptoms and signs of an illness are affecting a patient. So usually the person is invited into an office, often on their own initially, to assess what their symptoms are, why they're there to see you. So the psychiatrist will ask sometimes very personal questions about their life, about their family, but also about their symptoms, how long they think they've had symptoms for, how it's affecting their functioning, how they feel about it emotionally, what their thoughts are about their illness. Sometimes people with schizophrenia don't have understanding that it's an illness, so they might present it as a normal life event that they're hearing voices. So patients will be asked questions about their symptoms, signs, how it's affecting their life. Often family members or concerned relatives or carers will come with patients, and psychiatrists like to involve family and carers in management of their patients, and they're very important in the initial assessment as well, so that we can understand what a person was like perhaps before they developed signs of schizophrenia, how the illness has affected them, and what the relatives or friends are worried about. Sometimes the questions are difficult, but psychiatrists do take time over these questions. Often a first appointment will be approximately an hour, so there's plenty of time to talk through problems and your concerns with the psychiatrist, not only about the symptoms you've got, but also what the future holds, what the treatment holds, what the effect of the illness is on the patient. The treatment of schizophrenia is across many areas. Initially, the area that we think about is a biological or medication type treatment. That's combined with psychological treatment, so talking therapy, and also social treatments, so engaging families, making sure people are functioning well at work or in their study or in their relationships. So we have to, if we're going to manage schizophrenia effectively, we have to look across all those areas. Now, this is often done, it's done both in hospital, and it's also done in the community. Hospital is usually briefer times, but community is a longer time management. Now, as psychiatrists, we make sure that we manage people's treatment across all the areas of medication treatment, psychological therapy, and social therapy. Now, psychiatrists can do all of that, or they can involve a team of mental health professionals to become involved to help a patient. So whether that's a team in hospital of nurses, psychologists, social workers, occupational therapists, or whether it's a community team with a nurse in the community or a social worker in the community, or involving outside organisations to help people retrain or re-educate, or involving university staff, for instance. So that you have to, as psychiatrists, we have to look across all those areas. Now, the most effective treatments for schizophrenia involve something from each of those areas, but it usually involves medication. When a person has schizophrenia, sometimes it's necessary to come to hospital. Well, there are many reasons for that. There might be that the person, it's their first episode and they're frightened to be at home. They're just scared because they think there's people talking to them at home and they're just frightened. So hospitals are safe, supportive environment where they can come and be protected and talk to nurses, talk to doctors, talk to psychologists and be supported. And we see it as a safe place. So the person might just be frightened. Their relative might be worried about them. So their relative might say, my son or daughter or husband or wife needs treatment. I can't manage them at home. I'm worried about them. So that might be a reason to admit them. A common reason to admit them is that they might develop suicidal or self-harming thoughts. We know that 50% of people with schizophrenia do harm themselves. About 15% of people with schizophrenia do actually complete suicide and end their lives. That's a group of patients that if they're at risk of suicide, that's a very common reason why people come to hospital, because again, a safe environment where we can support people and help prevent suicide. So that's one of the reasons to come to hospital. In the rare situation where patients might wish to harm somebody else, that might be a reason to come to hospital. So people might think that a person in their environment is going to hurt them. So they might be afraid and they might come to hospital so that they don't respond to that fear by hurting the person they think might be against them, for instance. So hospital is an environment where they can come and be away from a person they might want to harm. So that's very important. So it's safety for the person as well as people around them. So the big two reasons why people come to hospital, the major reasons would be a suicide risk, harm or potential harm to other people, and the third reason would be that they're just not functioning in their life. So they're not functioning at home, maybe they're not even eating, maybe they're just hiding away in their room, not studying, not interacting with their friends, and hospital is a way of helping people adjust and become social again and to get normal social arrangements.